at a crunch for beds. We need the beds for the patients who are legitimately ill.
We need the beds for the people who are legitimately ill, because alcohol use disorder is not a legitimate illness. Addiction isn't a legitimate illness. They brought it on themselves. They caused these problems for themselves. This language is really unfortunate. This treatment that this patient is getting from this one healthcare provider is really unfortunate. And the clip is worth watching because there's other providers who are trying to genuinely offer assistance without the bias. Unfortunately, that bias is something that I still see regularly in healthcare spaces. And the question that I would ask that provider and others who think similarly is, how do we decide who is deserving of care? If the fact that somebody sort of brought it on themselves, if that's the deciding factor, then are people who do risky sport activities, mountain climbing, those sorts of things, when they're injured, are they still deserving of care because, they went and climbed the mountain? People who have received recommendations for managing their cardiovascular health or their diabetes, but didn't follow through on every one of the suggestions that their family doctor made or their cardiologist made. Are those people still deserving of care because they didn't follow all the instructions because they brought it on themselves? I think, how do we decide who is deserving? And if we don't want to move into a system where we decide to rank or have a hierarchy of who's deserving of care, then we need to agree that everybody is equitably deserving of care.